Everybody in the country is looking at Oregon right now. And here in Central Oregon, we want to be part of that transformation and really show people how we can do things differently.
An historic achievement for healthcare in Central Oregon today as a coordinated care organization is approved. Good evening, everyone. Welcome to News Channel 21 at 6 tonight. I'm Adam Arrow.
And I'm Nina Melhoff. The Oregon Health Authority has put Pacific Source in charge of the region's first CCO, or Community Care Organization. The CCOs are a key ingredient of the governor's prescription to change health care in our state.
But what exactly does this all mean for you? Joe Burns joins us now to break it all down for us. Joe.
Adam and Nina, Pacific Source will begin operating on August 1st, thus becoming one of the first 8 in the state to be certified as a CCO.
I'm excited about CCO development because it allows us to do things differently. It allows us to really transform care.
Dr. Robin Henderson is spokeswoman for the Central Oregon Health Council, a group of local providers who came together to talk about what needs to be done to transform health care. This week, they got their answer, as Pacific Source will become the High Desert's CCO.
Everybody's rowing in the same direction, and we're all going towards the same goal: better health, better care, and lower cost.
CCOs lay the foundation for the way in which care will be coordinated between hospitals, physicians, and other providers for the more than 600,000 Oregon Health Plan patients. Henderson says those who don't use the health plan very often, about 75 to 80% of those affected, are really not going to notice much of a difference. It's the 20 to 25% who have high needs who will feel the impacts.
We want people to be in their homes. We want people to receive care where it's most convenient for them.
One of the main projects of the transformation is in the emergency room. Henderson says the plan wants to help stop high-frequency users who treat the ER as their doctor's office at a very high cost.
If we keep driving everybody to the hospital or the most expensive levels of care, we're going to bankrupt our system. We're going to bankrupt our state, and our kids aren't going to get the education they need.
A story health officials like to tell is of a 95-year-old woman with a chronic heart condition who couldn't afford an air conditioner at home, went into congestive heart failure, and ended up in the hospital with a 2-week stay and a $150,000 bill. Henderson said with a $97 air conditioner, we could have changed that.
By doing those types of little things that we know work but aren't necessarily covered, we're saving the entire plan money that we can reinvest back in our community and the wellness of our community, making Central Oregon the healthiest place to live in the nation.
Oregon will get nearly $2 billion federal dollars over the coming decade to implement this key piece of health care reform. Joe Burns, News Channel 21.